two principles I want to affirm. The experts in the health system are at both ends of the stethoscope. The experts in the health system are at both ends of the stethoscope. So, and what doctors know is the what of care, and what we know, or you know, is the how of care. You probably know a bit about the what of care as well, particularly if you're living with a long-term condition or a chronic disease. The other principle I'd like to affirm is the patient's experience is everything. It's everything. We've got to get that. We've got to affirm that, stand firm on that, because it is. So, and Lorraine, I think I might have found a possible solution to your dream. Whilst measurement is important, we believe just as important is connection. So Don Berwick says, the meaning is not always in the metric. The meaning is not always in the metric. So we've got to be careful that our feedback is not one way, that it's two-way. We've got to be careful we don't become provider-centric in our consumer engagement, that we want consumers to engage our way. We've got to give options, because people will engage differently. So, in terms of patient opinion, there are 4 principles. We care about giving the public a voice, not necessarily a survey, it can be, and that voice is heard. We start with what the patient or carer or advocate or family friend wants to say, not what we want to ask them. We think we can change the care experience by connecting people, staff and patients, etc., rather than just collecting data. And we do it in a public way because it'll benefit everyone. Transparency is really important. We need a public good out there. So, what are we not? We're not a complaints platform. We're not a TripAdvisor for health. We're not a product or just a website. And it's not just about feedback. What are we? It's more about building those relationships with consumers and cultural change in organisations. So it's about that engagement, not just a rating site. It's more about an improvement culture than a complaints culture. I think we're stuck a little bit, and I think it was Karen that said we want to move away a little bit from that, from a complaints culture to an improvement culture. So here's something that I hope you grasp. I think we've considered patients for so long as data sources, and we now need to see them as energy sources. We often hear people say patients are the most undervalued resource in our health system. But what does that mean? What it means is our staff are missing out on the richness of the stories that shape and mould them as people, as human beings, as professionals, and their own personal development. So, not just data sources, energy sources. How do we spread the learning? So when people share their stories on patient opinion, it's not for the purpose of saying to others, shop here, like TripAdvisor. It's more about people talking to people who cared for them, telling the story about what went well, not so well, sharing their feelings about what brought them hope and comfort with the people that they encountered during their journey with their illness. When people write on patient opinion, they are not usually ordering an investigation. No, they're telling their story. They're giving us their donations, their gifts of experience, so that we can learn from them and reflect on them. The impact of this on storytellers, when it's well done, is healing and wider learning, both for public and staff, and a change in culture. And we'll hear from Melissa about that, Melissa Vernon, a change in culture that's more open, transparent, and egalitarian. There's a power differential here. And we need to level it up so that it's beneficial for everyone, not just for patients, for staff as well. So, patient opinion is about using technology to do 3 things: connect people, teach people, and change culture in new ways. So the only questions I'd leave, and I do have to leave, the only questions I'd leave with you is, how do we currently enable our patients and their carers to engage safely and anonymously and constructively with health services apart from complaint mechanisms? We need a low-intensive way of engaging. Low intensive. You know, complaints is tough. It's a tough gig. So we need something that's more low intensive. And how will the public know, you and others know, if health services are listening, responding, and are making changes where necessary as a result of the gifts, of their donations, of their story? I'll leave you with that. Thanks very much.